Vaccines are one of the most important health interventions that we can do. So clean water, antibiotics, vaccination.
I believe that vaccines are one of the few inventions of humanity that really change the course of our history.
COVID really brought to the fore the importance of building global vaccine manufacturing capacity.
Before this COVID-19 vaccine, we have never have a proof of concept that mRNA vaccine has ever worked. So by slightly changing the vaccine technology, and now the mRNA can target some other diseases such as cancer or HIV.
Vaccines are one of the most important health interventions that we can do. So clean water, antibiotics, vaccination. Without those things, most of us wouldn't be walking around today.
Yeah, we tend to forget about that.
I think we accept a lot of vaccination for our children. It's just part of normal life, really, to have these vaccinations. And we don't really consider very often what the world would be like without them.
I believe that vaccines are one of the few inventions of humanity that really change the course of our history. You could say
Absolutely.
that. The most famous vaccines are the ones we don't talk about anymore. For example, the smallpox ones, because they did their job. Now smallpox is not here anymore.
We do have polio vaccines that work really well at the moment, and they've done an amazing job at reducing polio cases worldwide. But both of them come with some really big risks of reintroduction of polio into sort of naive populations. So you've got the oral polio vaccine, which is an activated strain, which can revert to a vaccine-derived poliovirus, which can cause disease in a sort of immunocompromised and naive people. And we have the inactivated polio vaccine. But to make an activated virus, you have to grow loads of live virus. So there's a containment problem there going forward. So while we're still vaccinating regularly, that's not a problem. But if, with global eradication, you want to stop vaccinating, then you've got this risk of these vaccine-derived polioviruses coming back and causing disease in populations, which would sort of defeat the point. So that's why we're looking at next generation vaccines for polio that could be used alongside and after the current ones, so we could hopefully eradicate polio one day.
The virus-like particle project is part of the program to try and develop new vaccines to dengue virus. The existing vaccine is not very good and does need to be improved, and that is work with one of the other people within the VaxHub and with a company in Indonesia. In addition, just to the dengue virus vaccine is what we call a platform process, which will allow us to use the same methodologies to any virus-like particle which has an envelope to produce vaccines using the same methodologies.
COVID really brought to the fore the importance of building global vaccine manufacturing capacity, because as the pandemic hit, countries turned inwards to meet national demand for vaccines, and it meant that many countries in the global south were left behind. So in the wake of COVID, what we've seen is that there's been a plethora of initiatives to make sure that you can build that capacity also, so that when the next pandemic happens, or then there's the next infectious disease outbreak, that countries can adequately respond. And I think it's really positive, because it will not only improve local health security and equity, but it will also improve global health security, because infectious diseases and pandemics don't know any borders.
Yeah.
For us to actually have an impact with the research that we do, it needs to be taken up by the policy community and the public more generally. And that's what I found really, really interesting, is to really look at the intersection between the two. There are a plethora of initiatives that have arisen since COVID-19 to overcome some of the challenges related to costs, to infrastructure, to accessing technology platforms, to skills.
What we've seen with COVID is the fantastic potential of the lipid nanoparticle as a carrier for mRNA, but also some of the issues that we have with current formulations. So for instance, the temperature sensitivity makes it very challenging as a formulation to supply into the developing world, where you can't necessarily maintain the cold chain. So there's definitely room for improvement.
Is it possible to make them more thermostable?
That's a great question. There are a number of companies who are working on that.
I think in future we will have more mucosal vaccines. The other thing we will have in future is we will have more local production. So, for example, there is quite a lot of hesitancy right now in various parts of the world. And one way that people are less hesitant to take vaccines is if they know it's produced in their country or in their region, for example.
Yes.
So I think there will be more local production in different parts of the world.
Okay.
So I guess the technologies will have to become more portable,
Absolutely.
more distributed rather than in one place.
There are the things like that we've had vaccines every year. We have an influenza vaccine. Why do we have an influenza vaccine every year? Because the influenza vaccines that we have don't cover the new strains of influenza. So we constantly would want to try and develop what we call a universal influenza vaccine so that we could do that. That was one of the main aims of the company I was working at and still is.
I think the COVID vaccine research really shone a light on how many different technologies exist. I guess it is important going forward thinking about where technologies can be applied. So, are they applicable for low middle income countries and making vaccines accessible for everyone? So some of the new technologies, there might be a limitation there, but I think hopefully there'll be a really diverse sort of pool of vaccines we can pull on in the future rather than just one successful one or something like that.
So I'm working with vaccine hesitancy as well as developing vaccines. What I see in future, I think this will become more and more common. The vaccine developers will engage with people about vaccine much earlier in the process.
Yes.
So as soon as we start thinking about making vaccines, we engage with just the lay public about I'm doing this work on making this vaccine. What do you think?
For me, what is exciting is the evolving, keep changing technology. As we know now that recently the mRNA vaccine is getting more popular, and then before this COVID-19 vaccine, we have never have a proof of concept that mRNA vaccine has ever worked. So this is quite an exciting news for us that we can use the new technology to target the infectious disease or any other disease in the future. So by slightly changing the vaccine technology, and now the mRNA can target some other vaccine, some other diseases such as cancer or HIV.
There is an interplay which is crucial in terms of development between biology and medicine. They know about biology and medicine, that's fine. But a lot of people don't realize is the engineering part in the middle. Something is developed in a lab, it ends up in a clinic.
Mm-hmm.
But in order for that to be mass produced and end up in lots of clinics, we're particularly about vaccines, where you need often millions of doses, sometimes billions of doses. You don't produce that in a lab, you produce that in a factory, which is engineers.
Right.
And the engineers and the biologists and the clinicians, we all need to be working together.
I think we need multidisciplinary teams. We need people from all different sorts of backgrounds.
Yes.
And that isn't necessarily people who go and do a very traditional route, and different problems need different solutions. So we need people who can work well together, and people who can bring innovative ideas to the table and who are good at sharing.
Thank you for watching this episode of VaxHub Careers in Vaccine Development. To delve deeper into the world of vaccine development and production, be sure to also explore the other episodes in our video series and listen to the longer form podcast for in-depth conversations with a variety of guests working in this exciting space.